Okay, hello everyone. On this video, we're gonna talk real quick about the different lab tests that we use to diagnose diabetes. So for this, I'm gonna share, where is it? A slide from the PowerPoint, yeah, for you to see it better. Okay, so regarding the diagnosis of type 1 diabetes is very straightforward. It's a patient that comes into the ER. It's a kid that comes into the ER with severe symptoms, abdominal pain, fever, anxiety. It's a kid that looks like it has a very bad infection. And then when we run the test, glucose levels, plasma glucose levels is part of it, and it will be in the 300, 400s. I seen 800. So that's a no-brainer. Glucose levels are way too high. It's a young patient, most probably it's a type 1 diabetic. Now, for gestational diabetes and type 2 diabetes, we need to follow a certain pattern of steps. So the first one is the casual plasma glucose test. This is where the patient shows up to the doctor's office, and we have no control of the patient. We don't know if the patient already have lunch, dinner, breakfast, snacks. They just show up. They say what they have based on what the doctor is hearing and what the nurse provides from the triage. The doctor can say, you know what, I think you're diabetic. We're going to do a quick plasma glucose test, and then we'll see what happens. So regarding values, anything below 100 milligrams per deciliter is considered normal. Everything above 125 milligrams per deciliter, we can say you're diabetic. But what happens between 100 and 125 milligrams per deciliter? This is our gray area. So the patient is not normal, but it's not diabetic. We call them pre-diabetics. And we'll get to that later. But those are the numbers that you need to remember in order to decide if the patient is diabetic or not. So we have a patient doing a casual plasma glucose, and the values come somewhere in that gray zone. So doctors is gonna say, you know what, let's do something more specific. I'm gonna have to control the environment. I have to control the patient, and that's when they're gonna do a fasting plasma glucose test. So the patient's gonna call the lab. The lab is gonna set up the appointment, and they're gonna tell the patient you need to be fasting for depends on the lab. They can say 8 hours to 12 hours. So they're gonna tell the patient, you know what, your last meal has to be around 8 p.m. the night before you come to the lab, and make sure that it's a light dinner. So in other words, don't eat in pizzas, chicken wings, beer, stuff like that. So it's a light dinner, sensitive dinner. In the morning, the patient wakes up. Ideally, they can only have water. They cannot even brush their teeth. Toothpaste has a lot of glucose because fluoride is very sour. So that can change the values of the test. Some patients, they really, really need to have coffee. So if they start fighting it, I need my coffee, I need my coffee, black coffee is the only thing that they can have. And only a little bit. Yes, for them to say, okay, I'm good, let's move forward. Um, they cannot go to Starbucks and get their regular venti whatever coffee. I don't speak Starbucks, so I just know that venti is the very, very big one. So nothing like that. So ideally, just water. If they push it, coffee, but it has to be black, no sweeteners, no creamers. They'll do the fasting plasma glucose test. They'll draw blood from the patient, and if the value still is on the gray zone, or it's not something that the doctor can say you're diabetic, they can go to a oral glucose tolerance test. For gestational diabetes, usually doctors, for those patients, they'll go real quick to this one. For type 2 diabetes, in order for them to get to this point, they have to do the fasting first, get a number that is not something obvious, something in the gray zone in order to move forward. So oral glucose tolerance test is going to be for patients that are pregnant or a type 2 patient that didn't have the right information on the test. So the patient, same thing, is going to go fasting, just like a fasting plasma glucose test. They're going to show up and they're going to draw blood from the patient, and then they're going to provide a syrup. This syrup is very sweet. A lot of pregnant patients, they feel nauseated after it. We encourage not to vomit because then you have to start lower it again. So we'll provide the syrup, and we'll tell the patient, sit down, don't move, stay here for an hour. After an hour, the lab tech will come in, draw blood from the patient, and give the same indications. Stay here, don't walking around, don't go jogging, nothing. And then after an hour, they'll show up again and take a second sample of blood. Some doctors, they like to do this 3 times. So that means the patient has to stay another hour in order for them to take a third blood test. And on this one, we're gonna have a curve on the behavior of insulin and glucose in the patient's body. If for some reason by the second hour the patient doesn't have a normal glucose test, then we're gonna say this patient is diabetic. If the patient is pregnant, and it's gestational diabetes. So once we get the diagnosis, follow-up is going to be with hemoglobin A1C. Regarding hemoglobin A1C, this is the evaluation of a protein in the red blood cell that is in charge of moving glucose around the body. And like I mentioned in one of those tutoring sessions that we had, for something to move inside a body, they need to attach to a protein and move around, and glucose is not the exception. So glucose attached to hemoglobin, and that's what we do as a follow-up. If the patient has a proper control of the glucose levels, hemoglobin A1C is going to have a normal value, so the patient can continue with the same treatment and the same diet, exercise routine that they have. If the patient comes with a high hemoglobin A1C level, then we need to reevaluate the patient. Maybe they need to change the medications that they're taking. Unfortunately, most of the times it's because they still have the same diet, they have the same physical activity that they had before being diagnosed with diabetes. Okay, so we'll stop here. And I'll see you on the next video.